We are going to deal with council form of evaluation of NCNM licensing examination 277. The first one is candidate name, site, and the date of practical exam. The total scoring sheet is out of 100. Then we have marks, possible, marks received, and recommended time. Candidate preparation is out of 437, 57 marks. The first is the professional general appearance and the personal hygiene. The total is of 3 marks. You must present in appropriate and fitting uniform. Second, wear clean long hair tightened or away from face. The third one, you should present with nails short and clean with no polish. The fourth, you should wear closed footwear. Then hand washing, but you must do hand washing before any procedure. The second is data and information collection out of 4. The first one has 60 marks. Then demonstrate collaboration and the relationship creation with full staff. And then you must have, while you are doing council examination, you should have collaboration with the staff of the service you are working with. If it is maternity, if it is emergency, if it is pediatric, if it is neonatology, depend on the service. The second, receive client consent to participate. Before each practice, you should ask the patient for the consent. Then self-introduction to the staff. Demonstrate appropriate identification of client. Describe the reason for client interaction. The third one, in this part we are going to deal with part only. In the second part we will explain those parts of the council form of evaluation. Then the third, it is client health assessment. Client health assessment. History. The first one, history taking. You should gather information from the client. Then undertake appropriate document review, including grams and chart. The third one is physical examination. Physical examination, you can do head to toe assessment or demonstrate proper use of equipment such as stethoscope, blood pressure curve, and so on. Then the kind preparation to examiners. It should present. This is out of 12 marks and it should be done in 10 minutes. Present basic demographic data for client. Present current state, chief complaint on admission or immediate past medical history. Then describe the current client health need, nursing diagnosis based on assessment, and it is out of 3 marks. Then establish nursing care management in order for priority. Present a rationale for prioritization based on the theory. Then effectively present intervention to be carried out. The other is equipment preparation. Ensure essentials for effective hand washing are present and prepared. Obtain and prepare complete connect material for primary intervention. 10 aseptic or septic technique. Then the second part is provision of care out of 85 marks. Then the first part is essential competencies and provision of care. First one, demonstrate effective hand washing disinfection procedure. Second, ensure client privacy, ensure environmental safety, and position material and supply effectively. Perform patient procedures. Perform all procedural steps in appropriate order. Maintain asepsis and antiseptic technique. Demonstrate physical dexterity. Use time appropriately. Demonstrate economical use of materials in the current suitable and comfortable position of the current procedures. Then with after patient procedures completed out of 10 marks, it should be done in 10 minutes. Ensure current surface and comfort after the procedure. Arrange the current environment including disposal and the cleaning of equipment. Demonstrate hand washing or asepsis post-procedure. Document procedure and assessment appropriately and report to staff in charge. The third one is communication and professional behavior. Out of 10, 18 marks, 5 minutes. You should use language, appropriate language. If it is English, if it is French, if it is Swahili, depending on the language spoken by the patient. Speaks and acts in a kind, respectful manner to a patient, family, and healthcare team. Out of 2 marks, the third include patient family discussion. Fourth one, use therapeutic communication method for patient and family interaction. Then demonstrate critical thinking and clinical reasoning. Use time appropriately. Self-evaluation, the first strength mechanism for the assessment process. Represent a respectful attitude toward the examiner and receiving feedback. If you are going to receive feedback, no need to say no to feedbacks. Then the last one is the part focal integrating theory. The first, it is out of 10 marks and it will be done in 5 minutes. Then explain the rational risk benefit analysis of the different procedure to current examiners. Respond to questions related to the patient situation and the care. Demonstrate theoretical understanding of patient condition. Then describe the therapeutic intervention of a patient in the appropriate patient situation. How should code medication, procedures, laboratory investigation, and the exam is out of 100 marks, and it should be done in 90 minutes. Then after comment, we have assessor comments. Strengths, your areas for improvement, and the names and signatures, the name and the signatures of assistants. You may have 1 to 2 assessors, and then the date of full assessment. Then next part we are